Welcome to Take Me to Hogue, the podcast where we explore the future of healthcare with Hogue thought leaders. I'm Robert Brunswick, and today I'm joined by Dr. Kenneth Chang and Dr. Stephen Grossman, two of Hogue's newest executive medical directors. We're at Hogue's Sun Family campus in Irvine, where major expansion's underway, including a new cancer and digestive health hospital led by our guest. Guys, I was really looking forward to this today. One of my most favorite things I enjoy about being on the Hogue board and being involved with Hogue is the relationship I've built with the doctors, and you two are a great example. So let's have some fun and see if we can educate our listenership a bit. So I thought I'd start out a little bit as the audience gets to know you. Tell me a little bit about why you wanted to become a doctor. What drove you? What was your passion? Steve, would you like to lead us off?
Okay, I'll take that one. My gosh, I had a kind of joint interest, if you will, parallel interest in scientific discovery and I guess making the world better, making life better for folks who have, in my case, often have incurable diseases. I just saw that as a mission for my life going forward. And I think I've been blessed being able to go through the training and everything that I've gone through to then lead programs like the one here at Hogue to deliver that care and that scientific discovery. It's been a great journey.
We're going to get more into that. I hear often from many of the doctors I interact with about their passion for science and for inventing things. So I think your path maybe was not dissimilar. And Ken, how about yourself? Tell us why you became a doctor.
Yeah, very, very similar, Robert. I grew up in an immigrant family, so my parents did not know how to navigate, coaching their kids to go to the right schools and so on. But I had an amazing high school guidance counselor who suggested I should apply to the Ivy Leagues. Of course, then I didn't even know what that meant. I thought that was plants and stuff. But so I did apply to the Ivy Leagues and I got accepted to all of them. But there was one in particular, Brown's 7-year medical program where you get accepted into medical school from high school. And miraculously, I was accepted. And so I stepped into medicine, not having any background in medicine, but knowing that I cared deeply about people, knowing that I wanted to apply whatever skills I was given to be able to help people in their healing journey. So that was the beginning of my entree into medicine. And the deeper I went in, the more fascinated I became the miracle of the human body and how it worked and what happens when it doesn't work and how to get it back to that perfect body that we were meant to have.
I love that. I think as I've gotten to know you both, I think your passion for patient care, but also you're both curious and you're both inventors, if you will, and we're going to get into that a little bit more. But, I think about your CVs in my line of resumes, if you will, and backgrounds, and it's amazing. And we're so fortunate to have you at Hogue. But lots of choices for you all as to where you could go. How did you end up at Hogue, and why Hogue in your decision tree as to, this stage in your career, which is probably the most important part of your timing in your career?
Well, Ken beat me here by a year or so. So I'll let Ken take that one first and then I'll follow up.
Yeah. Since 1988, when I started my career in the public sector at a university, that's all I knew. Moving through the ranks of academic medicine, assistant professor, associate professor, full professor, steps 1, 2, 3, 4, 5, 6, 7, 8, becoming the chief of a division, becoming a center director, becoming an institute director. That's the only paradigm that I knew until I was introduced to Hogue. So for me, that was a real turning point. When I came to visit Hogue and saw the real heart and soul of this institution, understanding that the people driving the bus the C-suite, the board, the physician leaders, they were not about profits and volume. They were about how do we bring the best world-class care to our friends and families and neighbors here in Orange County, accessible to our community, so people don't have to travel to LA to get the best care. Once I understood that was the driving force and how hyper-focused Hogue was to be able to create that model and expand that model throughout all of Orange County, and that the dreams that I've had for decades about how we can transform the health of our community could be realized in warp speed, I was down.
So Ken, I want to double click on something because you talked about the model. And as I think the model of healthcare, the paradigm shift is changing. So as we think about, I'm going to broad base say there's 5,000 hospitals in the US today. They balance between academic and community. So there's a phraseology today that's being used, and specifically at Hogue, the privademic model. So is that the model you're referring to? And then can you describe it a bit for us as we think about part of your motivation? And then Steve, I'll have you do the same thing.
Yeah, I love the concept of privademic. The other way to look at it is science meets hospitality.
Okay.
If you think of your traditional community hospital, great service, easy parking, easy to get an appointment, friendly staff, someone will personally pick up the phone when you call, all of those is what we think of in a traditional community hospital. And when we think of the traditional tertiary university referral hospitals, we think of science, we think of clinical trials, we think of professors teaching students, we think of NIH grants and writing papers, but not so great in finding parking or getting the appointment or feeling like you're not just a number. But think of the power of bringing those two values together and having science and hospitality equally at the forefront of the priority of the institution.
We're going to dig into that a little bit more in a minute. But Steve, I want to hear from you. So the privademic we want to touch, but why Hogue for you? I mean, you started on the East Coast. Again, your CV is amazing. We're so glad to have you. Why here?
Well, a very parallel journey, starting in the Ivy League as well, a little down the road from Brown in New Jersey, and but from there, I also did a combined program for getting an MD and a PhD, that type of combination at University of Chicago, so the Midwest. But the rest of my career has been in Boston area and then in Virginia. At a few public universities, tertiary, quaternary, referral centers, academic medical centers, programs sponsored by the NCI, Comprehensive Cancer Centers, and so forth. And I rose through the ranks too, to the point of getting 2 different tenured positions, endowed chairs at different universities, all of that. I feel like I've done it all on the academic ladder. And along the way, I built a laboratory and done research for the past few decades in pancreatic cancer, lung cancer, and ovarian cancer, published many papers, NIH grants, all of it. And I was most recently at a large private university in the Los Angeles area, having come to the West Coast, where I think I'm going to stay. And but with all of that, every place that I've been, I have felt we have not really serve the patients as best as we can. Yes, the cutting edge care is there, the clinical trials, absolutely. But in terms of the patient experience, I just don't think we were delivering the highest level of patient experience and satisfaction for the patient, family, caregivers, all of it, and wrapping around the most holistic care. That is what community health systems do well. Community hospitals do that really well. And Hogue has brought together an academic mindset, folks like Ken and I and all of the doctors we've hired who are trained in the academic system. But we can deliver that care in such a compassionate, holistic way with parking. Parking everywhere I've been, parking is a bugaboo. But it boils down to the vision of the leadership here to say, yeah, that's important. We're going to make it right. That's not going to be 10th priority. Parking is going to be whatever, number 2, along with people picking up the phone and giving you a call back or getting an appointment as soon as you call. Things like that. So important to me.
So Steve, on the privademic side, because I want you to touch that, the Rubik's Cube, as you would think about it, is the academic institution has all the research, has those doctors passionate for that academic pursuit.
Yeah.
And that how can you do that in 2 environments in this privademic model where you can have clinical trials and fellowship and research? So how is that brought to life in a place like Hogue?
Well, it starts with a vision, and the vision starts with both our leadership and our donors. So the philanthropic support of Hogue, the Hogue Health System, Hogue Hospital, is nothing short of, in my experience, amazing. And that's the secret sauce. That's how we do it. We bring in the support of the community and our grateful patients so that we can build research programs right here in our community and serve our Orange County residents with the most cutting edge clinical trials that you can find anywhere in the country. And I'm sure we can talk about some of that in more detail.
Sure. So as we move along, I think I'd like to kind of move to, you obviously underwrote before you came here a vision of what opportunity existed. Now you're here, you're operating, you have teams of people working underneath you. So has your vision come to reality? What's it been like? What's your inside the house? What have you experienced?
Yeah, I would say for sure. Now, a year and a half in, everything promised has been delivered, and then some. And getting back to your earlier question, I echo what Steve said in terms of how do you create a culture that brings all of these pieces together and make it sustainable, right? And so one way to look at it is a simple phrase: happy doctor, happy patient. If you pick the right talent and you individualize that recruitment, you individualize their package, and you individualize their time distribution between excellent clinical care, research, and teaching, and you're able to align the funding for those different aspects of what makes that physician thrive, then you've got an amazing recipe for success. And once you onboard a number of those physicians, then getting more physicians to be attracted becomes,
It's like a waterfall.
It's a waterfall, absolute
It's a
waterfall.
cascade, yeah.
And that's what's happened. In my experience, I've recruited already 7, nationally renowned physician scientists and clinicians. And people wonder, well, oh my gosh, like, how did you get so-and-so here? How did you get so-and-so here? Because of the willingness and the boldness of Hogue to look at this model. And, Hogue is not for profit. So we don't have to worry about private equity skimming all profits away. Everything needs to be reinvested. You add that with a board that is, so financially wise in terms of allocating funds. And on top of that, the amazing generosity of our community to want to make Hogue the best possible. It's a winning combination that's sustainable.
So Ken, just to be clear, that culture you spoke of that you viewed from the outside, but then you got on the inside, how would you, the phraseology of that, how would you describe that culture as you now sit in the chair as a leader of people, as well as a practicing doctor?
The happiest place to practice on earth. This is the happiest place to receive care, but we also think it's important that it's the happiest place to give care, right? So if you have physicians that are under stress because of extra volume that they need to see and time at home to do their charting and and a quota that they need to meet, they will stress out, burn out, and leave. But we've created an atmosphere, an environment, a culture where we value all these different aspects, and we give the physicians the luxury of time, which means we give the patient the luxury of time. The patients won't feel like this is a 15-minute interaction.
Beautifully said. I love the way that's a great take home for us all. Steve, both of you you were right up the road, you were in the neighborhood, and with that, you had your perception of what Hogue was.
Indeed.
And now you're sitting in a chair wearing your Hogue jacket. So what's it like now that you're on the inside?
Better. It's better. Again, I'm becoming, I guess you have to be 15 years in something before I can say I'm truly West Coast. But, as I learned about the region in my first about 5 years in the Los Angeles area, there was a lot of connections of where I was to Hogue, sort of medically and patient flow, some of our patients from Orange County. So I got to know what was going on here, both in terms of the wonderful, patient care, patient experience. That's reputation goes far and wide in Southern California for sure. But what I also knew was there were clinical trials here, and I was very intrigued by that. And I began to learn more and more about what was going on here scientifically or on the research side. So I was already primed when the opportunity arose to look at this particular job, this position, thinking, that's interesting. What's going on down there? I need to take a drive down to, in this case, it was to Newport Beach for that first visit. But everything and more in terms of both the way we deliver care and the opportunities to advance care through science.
You and I have talked before that you spend your time equally balanced between managing people, overseeing the entire Cancer Institute now for Hogue, to patient care yourself, to doing your own research. So how do you balance that? Is there and recognize that they're all equally important in creating the franchise, building the franchise, if you will?
Well, the good news is I've had a lot of experience elsewhere doing more or less that type of time split of sort of running things, administration, doing my research, which a lot of it happens in the laboratory. A lot of Ken's research happens with patients in clinical research. And then the direct patient care that I deliver, by trade, I'm a medical oncologist specializing in the gastrointestinal types of cancers, right? So that split has sort of preceded my employment, coming to Hogue. So I kind of have it worked out. And it's not for everybody. It's, quite honestly, it's a bit of a 24/7, 365 type of thing. But that's okay for me because I just find ways to get everything done and make sure I keep, in a sense, all the balls up in the air.
Sure.
Because that's what makes me happy.
Right.
Happy doctors.
Right. Happy doctors. I love it.
That's what I want to be doing.
Give me a specific example of culture at work within your confine there in cancer.
Well, two things. The first thing is the culture among our Hogue physicians, which is remarkable. And I've been on a lot of different medical staffs in my day. I get down here and the expectation is we have a little system that we text each other. It's called Tiger Text. It's HIPAA compliant and all that good stuff, but it's just for physicians. And I'm like, that's cool. But the expectation is not expectation, it's just the way it works. If you're a physician and you need help from another physician, you either call them on their cell or you Tiger Text them. And what happens? You get an answer right away, not the next day, not next week. Even if you email them, they'll even answer their emails because it's important. Because you know why? They know you're not just, randomly reaching out. There's a patient behind that call, that Tiger Text, that email. That patient needs their help. I need their help. And they answer the call every single time. And that I just walked into that. And is that the norm at other places? Variable. not so much, right? So there is such a strong physician culture of collaboration that benefits our patients every day, right? So how do we then take that to the next level? And if you're a patient with cancer, what is the most important thing, aside from getting your cancer cured? The most important thing is getting it taken care of right away.
Sure.
Not next week, not 2 weeks, not next month, right? If they call, they want to get an appointment. Now, maybe next week, because that's okay if that's what they wanted, but they're going to get an appointment right away. Maybe the next day, if that's what they need. And we call it No More Sleepless Nights. That's our tagline. And we're piloting, we're starting this out in our lung cancer program. I've brought together the whole team, our medical oncologists, our surgeons, radiation, pulmonology, all the stakeholders for lung cancer. And they have come together as a team, we brought them together, and they have gelled. And this is their number one priority, is if someone calls our pulmonologist, they see that patient next day within a couple days, make a diagnosis, get them on to surgery, from surgery to medical. And we have decreased time from phone call to treatment, first treatment, cut it in half. We're now just a couple weeks out. And there's a lot that has to happen, if you can imagine, all the testing, all this kind of stuff. And the only way that has happened, yeah, we have operations, we have lots of administrators helping us do it, but it's because that's what the physicians wanted for their patients. And they made it happen. And it's just getting better every day.
Steve, I love how you metriced and brought back culture in a tangible way with a take home for its benefit. That's so hard to do as people talk broadly about culture.
Yeah, so make it tangible.
Ken,
exactly.
maybe a little from your perspective.
So the Tiger Text, our Tiger Text, it has a special ringtone. So all my family knows, oh, you've got a Tiger Text from another physician, and I can be excused from dinner or whatever to address it. And sometimes it's questions to a team, like, what do you guys think is the best next step? Sometimes it's, hey, I need an urgent referral. So from that, it's an instant message to my scheduling staff. If it's at night, then the very next morning, they're calling the patient to get them in for an appointment. And so next day, next week appointments are routine. And we get patients in. And then when they come in, a new patient will have 45 to 60 minutes, not 15 minutes. And we spend all the time that they need and make sure that everything is looked at. There's no leaf unturned in their care, because a lot of these patients are quite complex and they've seen multiple physicians. From there, we may schedule a diagnostic or an interventional type of procedure. When they come into our endo suites, they're greeted by the same nurse that's going to do the pre-procedure, pre-op. We'll see them in post-op, and possibly that same nurse will be calling them the next day. Hi, Mrs. Jones, how are you doing? And they not only know the patient, they know what procedure they had, and they're asking very specific questions about how they're. So that's the culture at Hogue. That's like,
it's a family.
It's a family, yeah.
I love to hear it.
Patients are part of the family.
Because I think for a lot of patients, they get lost in that daisy chain of they have to see 3 specialists and they feel that there's no navigation. So to integrate and navigate as part of the culture, I can tell you from many patients I talk to, is key.
And we haven't even talked about that, because what we have done in cancer, and again, in partnership with Digestive, is invest in specific nurse navigators for each of the diagnostic cancer areas. We'll have a lung cancer part of this No More Sleepless Nights, is our lung cancer nurse navigator who's helping patients navigate, from one specialty to the next. So there's always that constant point of contact for the navigator, and we have it in our gastrointestinal, in our skin cancers, and on and on and on. We have a navigator for every indication, who are that glue that help keep the patients connected to physicians. It's just another example of the investment and the vision at the top levels.
And a lot of these value-added services, like a dedicated nurse navigator or a social worker or a dietitian, they're not billable. So most centers that are for profit won't have it. Those that are have a tight budget can't afford it. But Hogue, with its as a nonprofit, as a community-based support, if that's what we need, that's what we get.
Yeah. Well, I love to hear that. The secret sauce, right?
Yeah.
Aside from the stellar CV, help us get to know you, Ken, a little bit for our listenership. What makes Ken tick? You know, I mean, I know you got a special family situation. I know you got community stuff that you're involved with. Help us get to know you a little bit, Ken. Tell us about yourself.
So I've really seldom shared this part of my story. And when I was starting in medical school, I was depressed and considering like why keep going in life. And then I got into a near fatal car accident, but miraculously I survived. And the next day, instead of going skiing like I had planned, I went to church. And there was a message that day. It was a New Year's message, something like, you know, your life is not your own. God called you for a purpose. Seek out that purpose and live your life to its fullest, something like that. And I felt like that was like a message just for me. Like, don't be stupid. Don't think about ending your life because life is hard. There's a purpose for you to be here and seek out that purpose and live on, kind of thing. And so I felt that from that moment on, I was living on borrowed time. And when you live on borrowed time, certain things don't matter as much, and certain other things matter a lot. And so I'm here for someone else. I'm here for my autistic son. I'm here for my family. I'm here for that patient sitting across from me with a really bad disease when no one's been able to help them. And then just tapping into obviously experience and expertise, but also, you know, an inner prayer for that person that God showed me what I need to know to help that person. Let me be that conduit of wisdom and love to make a difference in that person's life and to be a touch point for them. That's really what keeps me going.
Beautiful, beautiful. Top that.
Yeah. Wow.
Sorry.
That was great.
You know, I guess where I come from, my family origins are probably important to understanding who I am, as for everybody,
Sure.
often, most everybody. And I come from a family that prized education for sure, but was also somewhat scientifically inclined, engineers, physicist, one Dante scholar, go figure, and including rockets. My uncle who worked on the Apollo moon project, building rockets. So there's a lot there in terms of discovery and learning, and that fired my spirit of seeking to learn what we can about the human body and again, treating the most intractable conditions. That's kind of what drove me forward. And, you know, as I got through my medical training, doing cancer research, kind of randomly, I wouldn't say I come from a family background where my grandfather had cancer, but it wasn't a pervasive problem in the family. However, when I started doing research in the laboratory, it totally transformed my thinking and understanding of what I wanted to do. Because I was working on cervical cancer then and the HPV virus, and we were just figuring out that it was the link there, it caused it. And it seemed to me, wow, this is the early stages of how we're going to cure this cancer. We got a virus, we just have to knock out the virus. Well, it's not been so simple over the years, but that was the idea. And so as I progressed through my medical training, I knew I wanted to go into the cancer field. And even when I got to the cancer field, I knew I wanted to go into the field that had the worst cancers, which arguably is some of the digestive cancers, pancreatic, stomach, and esophageal cancers, colon cancers, because that's where we can make an impact. I want to make an impact. That's what gets me out of bed every day. And that impact is through innovation and discovery, finding out something new that nobody else knew the day before, right? And also getting in front of, like Ken said, getting in front of patients.
Giving them hope.
And giving them hope, holding their hand, even if you're at the end of what you can, quote unquote, do. You're still doing something.
Yes.
You're still bearing witness. You're still there for that patient.
Guys, I think it would be valuable in the spirit of transparency and just candor if you could share a little bit about maybe doubts you might have had before you came to Hogue and made that decision to join our team.
Well, as it was a really exciting opportunity. I want to make that clear. But is it a jump for someone who's had a nearly 30-year academic career? Again, most recently as a tenured endowed professor at a major top 10, top 20 major research university in the United States. Yeah, that's a big leap. It's a leap of faith.
There was a bet.
There's a bet there, absolutely. I felt the resources, the culture, the patience, the beautiful location, and so much more was really in place. But I had to do some due diligence. I will tell you that I kind of had a coach, a kind of leadership coach, who happened to be the former dean of one of the top Ivy League medical schools in this country. And I actually knew him back when I was at University of Chicago. He was my chairman of medicine, just randomly, and later was my coach. But this former dean of a school of medicine said he thought this was a great opportunity. He saw it, and I was still having some doubts. So, but that was helpful. Also coming to a place like Hogue, which is not necessarily known that well by the major granting institute, NIH, some of the other federal grant institutions, the large foundations, American Cancer Society. Again, a little bit of a leap of faith that I could come here and continue to fund my research to advance cancer care. And I will say, if I can give you a little anecdote that just happened literally a few weeks ago, because Hogue actually does have a track record of funding by NIH and the Department of Defense as well, and some other major foundations. But the one not yet that has connected with Hogue is the American Cancer Society, the biggest nonprofit supporter of cancer research in the country. I had gotten grants from ACS over the years. I come here and I'm about to submit one to ACS just a few weeks ago, and I call them up with some questions, and they questioned me back saying, "We don't know anything about Hogue. Can you tell us?" And I told them the whole story, what we've just been talking about here. And they said, "That sounds great, but we need to do our due diligence as well." I just want to say that. And we sent them all of the grants, all of the peer-reviewed publications we've put out, over 50 publications over the last 2 years, and other data that they needed to determine that we were eligible to receive funding for basic and translational research here at Hogue. And that was a firm and a very enthusiastic yes from ACS. And my grant just went in 2 days ago. So,
Congratulations.
So it was a leap of faith, but one well worth taking.
Excellent. I appreciate that.
I would say yes. There were a lot of things that were racing through my mind in terms of things to cause me to pause before making this decision. And a lot of it surrounded really the impact that I was hoping that would happen at Hogue, the impact that I would make to our community through Hogue. So specifically, would I be able to have the impact in clinical trials? And I was worried that Hogue wouldn't be able to bring in and maintain the clinical trials that I'm used to doing. But dial forward, we brought in more clinical trials than we've ever had before in my tenure. The next thing I was hesitant about is advanced education. I've been training advanced fellows for decades. Could Hogue really help me get an advanced fellowship started? 3 months in, I had 2 advanced fellows. Check. And the advanced surgical fellowship is about to start in February. The next was, well, can I recruit high-level talent to a non-university setting? So I was concerned about that. again, 7 additional high-end world nationally renowned faculty have come. To my amazement, they're as attracted to Hogue as I am. And finally, I would say, in the medical technology world, it's so important, our relationship with industry, the key companies of the world, the Medtronics and the Boston Scientifics of the world. We have personal relationship with their leadership and their C-suite. And I was hesitant because if I come to Hogue, would industry view Hogue as, well, that's not where we want to put our resources and dollars and, first in human and all of that. But to my amazement and surprise, it's the other way around. We're getting more collaboration, more interest, more enthusiasm from industry than I had in the public sector. So all of my hesitations and worries, have been completely dismissed, and so surprised in the other direction. And I guess, if I can give you just a picture of my hesitation, it was during my interview day, and I stood outside the front of one of the Hogue's building as I was touring, and I was kind of in that, should I do this? And I looked at the door, the swinging doors of the building, and there on the door, I think, was a sign for my hesitation. It was Psalm 121. It said, "The Lord will guide your coming in and your going out." And I'm like, okay, then it's meant to be.
There we go. You can control things. Some things you can't control others. Yeah. Well, great summary, guys. I think in large part, like we all do in life, sometimes those fears that we worry about, we ourselves can control and manage those with our influence. And both of you have brought such phenomenal influence to our institute that those hesitations you had, I think you've helped manage through those and make a better organization for all of us.
Absolutely.
So,
yes.
Thank you.
Thank you so much.
Guys, this has been amazing. I can't thank you enough for the time we spent together today. I hope you've enjoyed it.
Absolutely.
You clearly are brothers from another mother. You finish each other's sentences, and I love to see that. And I think it speaks so highly to our culture and what you've been talking about today on our show. So thank you. You didn't disappoint. We appreciate everything you do for Hogue, and I'll look forward to running this back with you another time.
Thank you, Robert.
Enjoyed it.
Thank
Thanks,
you.
Rob.
Yeah.